Covenant Care, in partnership with local law enforcement and search and rescue teams, manages a program featuring a tracking system to quickly and safely return loved ones to their home. Here to tell us more about Project Lifesaver is Audrey Hanline, Program Manager at Covenant Alzheimer's.
Welcome, Audrey. We are so excited to have you here.
Thank you, Brandy. Glad to be a guest on the show today.
You are a program manager at Covenant Alzheimer's, which is actually a service line of Covenant Care. So we'd like people to know that. Y'all are doing lots of exciting things in the community, and I think this resource is even better.
Absolutely.
Well, you're here to talk about Project Lifesaver. So can you give us a little bit of an overview? What is Project Lifesaver?
Project Lifesaver is a program for patients who are at risk for wandering. It combines technology, education, and training, and it equips the local communities with a resource to be able to find those vulnerable populations who are at risk for wandering. And it works for adults with cognitive impairment as well as children with autism or some type of disorder or brain injury even that puts them at risk for wandering. Adults with Alzheimer's disease, they're at a high risk for wandering. 60 to 70% of patients will wander.
Wow.
And of those that do wander, most will wander repeatedly. And this program can help bring them home safely.
Definitely, and it's good to know that it's not just for seniors, it can be used for children as well.
Yes.
Wow. Is there a cost associated? Can you tell us, actually, before we get to that, tell us a little bit about what the band looks like.
Yeah, and this is one of the standard transmitters that patients wear. They can wear it on their wrist or on their ankle, and each bracelet has a unique frequency number located on the inside.
It's super light, too. So
and there are different bands and different colors that they come in, so it's pretty appealing for some of the kids that wear them.
So they can be a fashion guru with their bands.
Yes, and we have people decorate them and put little jewels and stickers on them. The point is they just have to wear it all the time, and if they get lost, the caregiver will call 911, and local search response teams will come out and use that frequency number to find them.
That's great. Is it waterproof?
Yes, it is
that
waterproof.
That would be my big concern.
Yep. And the batteries, they last around 30 days.
Okay.
With some of the GPS models of the tracking, they have to be charged like a cell phone. So that would be, the patient would have to take it off. But this, they wear it all the time, and we change out the batteries every 30 days, make sure it's working properly.
That's wonderful. What is the cost for something like this?
We provide all the equipment at no charge and all the maintenance supplies. We do have a monthly maintenance fee that we charge on a sliding scale. So we have people who pay $25 or $50, or the most is $75 that people would pay. It helps us to maintain the program. Excuse me, and we have around 70 people enrolled right now, adults, and then another 25 to 30 autistic children in Escambia and Santa Rosa counties.
And that's pretty affordable, and you all handle all of the maintenance for it.
Right, and we work with the local search teams, the Escambia Search and Rescue, the Sheriff's Office, all the different response teams that actually do the work of finding them.
What's the first step to getting a loved one enrolled in the program?
They can contact our office. We handle all the enrollment. We get basic information, the caregiver's name, any medical conditions, any patterns to the wandering that caregivers and the people that are looking for them might need to know. Like, do they go to a certain place, or is it a certain time of day that they tend to wander? And we'll get a picture and have a profile ready in case they need to use it.
So essentially anyone is eligible. It's not based upon whether, a certain income.
Right. We do try to work with the families and make sure that if they need it, they can get it. We do have grant funding and some additional donations that cover the cost for folks who can't afford it.
Do you have to have any sort of physician's order to say that they
Not
have
at this
Alzheimer's?
time.
Okay.
No, if they have any type of cognitive impairment that puts them at risk for wandering, we will work with them. We have people with brain injuries, stroke-related dementia, Alzheimer's, even adults that are younger adults, and even in their 20s that are at risk for this. We'll put them on.
That's incredible. So they just need to call your office if they want to get more information, or if they want
and visit
to
the website. There's a good. There's a few videos on the website that kind of goes over.
Tell a lot more information too, and you'll be able to see how it works.
Yeah, absolutely.
That's wonderful. If they want to come in and talk to you, are you open to have people come in and talk to you?
Absolutely. Please come talk to me.
What other resources do you have?
We offer support groups, education for caregivers and professionals. We do memory screenings. We are in the process of building a memory care center. But a lot of the education support, we work with Philips medication dispensing.
Okay.
basically to help people remain in the home as long as possible and as independent for as long as possible.
And that's really important to Council on Aging, is we want to keep people in their homes for as long as possible. So I know I will be sharing this resource with our case managers and see if some of our clients are eligible for this. So is there anything else you want to touch on with the band? You can get them decorated. You can call
They're
about
waterproof,
them.
they're tough, durable, resistant, and we have different colors and different bands.
Awesome. Well, thank you so much for coming on the show. That was a lot of information. I know there will be quite a few people interested. So if they're interested in getting one, they can call the number on the screen. We've also got the website, and you'll be happy to answer any questions they have.
Yes, ma'am.
Thank you for coming on the show, Audrey.